everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today, I want to put some awareness out there about some changes coming to telemedicine as of April 1st, 2025. I've had a really hard time, honestly, finding like the final rule that Medicare is putting out for the telehealth changes coming in a few weeks. However, I did find a Medicare on their website bulletin about the things that they were extending from the end of last year through the end of March, which tells me that since the things they listed is only going to be good until March 31st, that April 1st it's going to not be, and it's going to revert back the way it was before the pandemic. If you are in a specialty where you are not behavioral health or considered behavioral health, you really need to look into these. Even if you are behavioral health, there are a few changes coming down the line for you as well, as far as requirements for telehealth. Although most of your guidance and your abilities through Medicare have been finalized a while ago and you're mostly good to go, there are a few things to note. If you're not familiar with an originating site or a distant site, you need to become familiar with them, because that is going to play a huge factor on whether you are able to offer telehealth services to your patients after the end of March, beginning of April, and also depending on the specialty that you're in. I printed off a grid that was really, really good off of the American Hospital Association, talking about what was pre-pandemic and what they kind of have been loose about on their regulations that most likely are going to revert back to pre-pandemic times. So I'll go through that in just a second. But I want to discuss originating site and distant site because that is going to play a huge role when you look up stuff regarding telehealth. The originating site is the site in which the patient is present when they take the telemedicine call and video. Where are they specifically? There are going to be specific places that they can only be in order for this to work. And so you have to make sure that the patient would be fulfilling that by being at an approved originating site. The distant site is the place where the provider who's offering the services via telemedicine is present, okay? That is where you are going to be in a doctor's office, or you're going to be here or there. That's going to play a huge role as well. There are going to be very strong restrictions on both distant site and originating site. So now I'm just going to jump in and read from this document that I got, and I will put the link in the description of the video so that you can look at it as well when you're doing your own diligence. Again, there is no, quote, very clear final rule. There's just information on the Medicare website, which I will put the link to as well in the description of the video, where it says all of these things that the government extended through the end of March 31st. We haven't officially heard that they're not going to extend it again, but we also haven't heard they are extending it. So just work on the fact that they're probably not going to extend it and it's going to revert back as of April 1st. Again, I will put that link so you can do your own research on that. And I think the reason they did that is because originally all the telehealth stuff that happened during the pandemic was going to end December 31st, 2024. And then Congress got together and they were like, wow, there's been a lot of stuff going on that's benefited patients with telemedicine. So we're going to extend it another quarter into the following year to see how it goes. And there have been a lot of large entities fighting to extend it, to make some permanent changes to telemedicine, etc. However, we haven't heard a final. So right now, as it stands, it sounds as if April 1st, this is all going to revert back. So here we go. Eligible geographic and originating sites. Pre-pandemic, which was the permanent statute, which means that as of April 1st, it would revert back to what I'm going to read. Patients had to be located in a rural area or a health provider shortage area and had to be physically located in a specific setting, for example, a physician's office, to participate in a telemedicine visit. So this means that not only would the patient have to be rural or in a proven health um, provider shortage area, but they couldn't do it from their home. They would actually have to go into a doctor's office that you partner with, maybe, or contact, or someone they ask, and be there. The waiver that happened during the pandemic is that patients can be in any geographic area, rural or metropolitan, and in any setting, including the beneficiary's home at the time of a telehealth visit. Okay. Audio only services. Pre-pandemic, all telehealth visits had to be performed using real-time audio-visual telecommunications technology with limited exceptions. So you couldn't just do the phone, you had to see them and you had to hear them. The waiver allowed for expansion of audio-only services for evaluations and management visits, so E&M visits, and other specified services. So there was still some guidance on that, but it was pretty open. E&M is pretty general, right? Eligible provider types. Pre-pandemic, so this is what would revert back as of April 1st. There were limitations on the types of providers who could perform telehealth services. During the pandemic, the waiver allowed additional providers to perform telehealth services, including physical therapists, occupational therapists, speech language pathologists, and audiologists. If this affects you and you're in one of those specialties, you need to be paying very close attention. Eligible distant/provider sites. This is pre-pandemic. Providers at FQHCs, which are federally qualified healthcare centers, and rural health centers, or RHCs, could not provide telehealth services to patients in other locations. If you're FQHC and RHC, you really need to pay attention to this. The waiver allowed the FQHCs and the RHCs to serve as distant sites for healthcare telehealth. Okay. Again, this is very tricky depending on your focus, your specialty, your location, right? The next one, telebehavioral health. Patients had to receive an in-person evaluation 6 months before initiating telehealth behavioral services. The waiver allowed in-person evaluation as not a requirement prior to initiating telehealth for behavioral health services. So that means that they're probably going to be going back to requiring behavioral health patients to be seen 6 months prior to being able to do telehealth. I think it's for like a stability reason. And they're probably also going to go back to making them do an in-person visit annually thereafter to check in, which I think is a very good practice, honestly. And if I was in behavioral health or I worked with someone in behavioral health, I would encourage that practice anyways, even if they weren't to revert back to the original pre-pandemic requirements. These things that I'm going to be talking about now are actually still good until the end of this year. So everything I just talked about is going to change as of April 1st, 2025, but all of these other things are actually going to change at the end of 2025. So it gives you a little bit more time to prepare, but these are some things to be aware of. Virtual supervision. This is pre-pandemic. Clinical supervision of telehealth required immediate in-person availability of the supervising practitioner, so they had to be with them. The waiver allowed clinical supervision of telehealth diagnostic tests, physician services, and some hospital outpatient services to be met through virtual presence using real-time audio-video technology. So the supervising provider did not have to be on site, basically. If they could be reached audio visually, like electronically, then it was okay. But this is reverting back as of now at the end of 2025. The next thing, virtual supervision of residents in teaching settings. Teaching physicians could meet requirements for supervising key or critical portions of resident services through virtual presence instead of physically in person, but only for services furnished in residency training sites in non-metropolitan service areas or non-MSAs. The waiver allowed flexibilities for virtual supervision of residents were extended to include MSAs as well as non-MSAs. So this pre-pandemic, you had to be in a non-metropolitan service area, and after or during and now during after pandemic, they would do for non-MSAs and MSAs, but now it's going to revert back at the end of 2025 to only non-MSAs. Virtual supervision of cardiac and pulmonary rehab services. This is pre-pandemic. Clinical supervision of cardiac rehab, intensive cardiac rehab, and pulmonary rehab services required immediate in-person availability of the supervising provider, again, on site. The waiver allowed clinical supervision of pulmonary and cardiac rehabilitation to be met through virtual presence using real-time audio-visual technology. So just like the general supervision that we talked about above. Reporting of provider home address. Providers, this is pre-pandemic, providers who administered telehealth services from their home were required to report their home address on enrollment, billing, and claims forms. The waiver during the pandemic, providers were not required to report home addresses on enrollment, billing, and claim forms. But it sounds like at the end of 2025, they will go back to requiring it as it stands now. And then the last one is payment of virtual outpatient therapy services. Pre-pandemic, CMS restricted the ability to bill for telehealth therapy services, which we talked about a little bit earlier. And the CMS, during the waiver of the pandemic, allowed institutional providers, which means inpatient, to provide therapy services, including outpatient physical therapy. So that once they transitioned, occupational therapy and speech language pathology via telehealth to patients in their homes. So definitely, if you're in these specialties or you're going to be affected because you've been offering telehealth, you need to be looking at what's going on and try to prepare for the changes that are coming until you hear otherwise. The one last thing that I want to talk about is that the DEA, I guess, had issued temporary waivers regarding prescribing of controlled substances. And this is going to expire at the end of 25 as well. So what I'm about to read affects DEA and controlled substances, and there was a waiver because of pre-pandemic versus pandemic allowance, but it's going to change at the end of 2025. So in-person visit requirements for prescribing of controlled substances. The pre-pandemic permanent regulation was prior to prescribing controlled substances, the prescribing practitioner was required to conduct one in-person evaluation of the patient prior to prescribing. This could be waived through a special registration process per statute, but DEA has not finalized a regulation on what this special registration process would entail. If you have controlled substances that you prescribe and you've been doing it, you probably are aware of this. The waiver during the pandemic was that in-person evaluation requirement was temporarily waived, but there's a note that says we recommend creation of a special registration process to waive the in-person visit requirement. So we still don't know what that kind of permanent final regulation is going to be. So I would be following up on that closely too. If you prescribe controlled substances and you use telehealth as one of your availability, and you'll be able to continue doing it from the changes that are going to be happening April 1st. But this is just an example of things that you have to stay on top of. I would hate for you to continue trying to build telehealth after April 1st, not aware of this, and you're not getting paid and things are getting denied because you weren't up to date on this. So please check out the links I'll put in the video description. Rewatch this video if you need to take some notes and take it to maybe whomever in your practice might be in charge of this to discuss it with them, and do your own diligence. These videos that I do are just to bring awareness. They are to help you jumpstart the process of figuring out what's going to be best for you and what's going to be affecting you in your practice. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit, that need to know about the telehealth changes coming in April of 2025. Be well, take care of yourself, and we'll see you next time. Bye-bye.